we are going to Ribe. And, believe it or not, there's a loose but interesting connection to Tartary in Ribe. Allan, Odin, Sipa, and I are setting off for Ribe in Denmark, the oldest city in Scandinavia. We're traveling from the east coast of Sjælland, across the island of Fyn, and over to the west coast of Jutland. It'll take about 3 hours to get there. We're checking in to the hotel back house, and this little bay window is our suite. The hotel was built in the mid-1800s and was originally a bakery, just down the cobbled street from the Ribe Cathedral. The first permanent structure in Ribe was the cathedral, built in 1150. Many buildings in the town center were built in the 14, 15, and 1600s. This tea shop was built in 1442. And old, dank air from the cellar wafted up that seemed to smell of the 1400s. It was both unpleasant and at the same time fascinating. The Hotel Dagmar was originally the home of the town's mayor, and was built in 1581. It was the perfect place for a cocktail. On our second day in Ribe, we had breakfast and then walked around the Viking Center. But back in the center of town, there was one thing we couldn't find, and that was the birthplace of Petrus Severinus, a location that's been lost to time. Severinus was a Danish physician, born in Ribe in 1540 and educated at the Ribe Cathedral School. According to Wikipedia, Severinus was one of the most significant followers of Paracelsus, an alchemist of the 15th century, who opposed the mainstream medical philosophies of his day. Joel Shackelford, associate professor and director of the History of Medicine program at the University of Minnesota, writes that Severinus was one of the first physicians who actually took Paracelsus' ideas and elaborated them into a coherent and cogent body of doctrine. Severinus' work was written in Latin under his Latinized name, Petrus Severinus. Francis Bacon, who was not a fan of Paracelsus, did, however, respect Severinus. And Severinus did have a scientific reputation. He was the royal physician of two kings of Denmark, Frederick II and Christian IV, a Danish king whom Bacon knew personally. In 1571, Severinus wrote Ideal of Philosophical Medicine, and here on page 260, he mentions something very Paracelsian in medical philosophy. Certain impurities are relinquished, which, by a spiritual vapor, seem to be conveyed together with the food to the workshop or laboratory of the liver, of the blood, of the flesh, of the sinews, etc. These are not only impurities tending toward dissolution, but also tartarius mucilaginous coagulations, from which diseases arise in the liver, kidneys, bladder, blood, flesh, brain, lungs, heart, joints, throughout the whole body, forming stones, bony growths, tophaceous deposits, bituminous concretions, etc. These tartarius coagulations would include things like kidney stones and the crystals of uric acid that result in gout. And in the view of Paracelsus, these coagulations had precipitated out of solution. This is why they're referred to as tartarius, after the wine sediment of tartar, potassium bitartrate, that precipitates out of wine, its crystals collecting on the cork. This is a phenomenon I discussed earlier in this video. The concept of Paracelsian bodily disincorporation is explained pretty well by J. Compton Burnett in his 1895 book Gout and Its Cure. Paracelsus' conception of the true nature of gout is true to nature and tallies exactly with my own. He says each organ has the power to separate the hurtful from the harmless, and when in this faculty it goes astray, there we get tartarus. And thus for Paracelsus, tartarus is that which ought to have been excreted but is not, and remains in the body as hurtful material, producing mechanical irritation. Thus stone in the kidneys, bladder, liver, lungs, intestines, under the tongue, or in other regions, is tartarus, and also acidity in the stomach and bowels. Now put the word gout in the place of tartarus, and we clearly see that Paracelsus knew as much of the true nature of gout as we of today, who talk of the uric acid diathesis and the like. Moreover, he knew how to dissolve stone in the living body, at which the scholastic wiseacres have been laughing all my life, and yet they now howl at those who question the power of the much-advertised piperazine to do the same. That is the alchemy of Paracelsus, dissolving stone in the living body. The act of dissolution is an act of separation, and this is a distinction we've lost. That chemistry is the science of combining, and alchemy is the science of separating. And it's the separation that solves the problem here. The body dissolves compounds, separating them into their constituent ions, but these dissolved substances can later precipitate. When calcium ions, for example, recombine to form a mineral deposit, that is an act of reincorporation. That mineral, that stone, can then be deposited into the body's soft tissue. And as Burnet says here, Paracelsus was concerned with the body's ability, and even its responsibility, to separate out what is hurtful. And there's a difference between what Burnet calls a chemical fix and a vital fix, and Paracelsus was concerned with the vital fix, when the body is engaged in healing itself. Essentially, the cure of the gouty state by mineral waters and alkalis is mainly chemical. They set up a condition of alkalescence, and the uric concretions are thus rendered soluble, and the mass of fluid drunk washes them out. While in the homeopathic treatment, the organism itself becomes its own sweep and turns them out. That the action of urtica is vital may be further seen from the fact that it loses its action as the individual ceases to react to its stimulus, whereas the chemical cure can be repeated almost at will in the same individual. He's saying here that the body stops accepting the cure when the body no longer requires the cure, whereas a chemical reaction will occur whether the body needs it to or not. The vital solution he's giving here for dissolving stone in the living body is Urtica urens, the herb called stinging nettle. And amazingly, this method of dissolving stone in the living body was offered to us in the little tea shop in Ribe built in 1442, here in the same town that spawned the man who would legitimize Paracelsian medical philosophy. I had asked the shopkeep if she had any dandelion root tea, and she didn't, but offered stinging nettle instead. Little did I realize how meaningful and how prescient this suggestion actually was. It was amazingly relevant to our experience living in Denmark. Within a month of moving here, both Allan and I experienced a variety of symptoms that all seemed to point to a hardening or calcification of muscles, joints, or the fascia. It came on suddenly for both of us right after we arrived in Denmark. Doctors here initially thought some of Allan's joint pain in his wrist and shoulder was a form of gout, but his uric acid levels weren't elevated. My theory is that it's an elevated level of calcium. As I mentioned earlier, we live on Sjælland. Specifically, we live on top of a European chalk province that's visible in the sheared-off coastlines of Stevensklint, Roneklint, and Mundsklint, all within 15 miles of the school in Youngsholm where we live. The calcium in Denmark's geology is on display in the smaller churches that dot the landscape of Sjælland. Many of them are a bright, glowing white because the exteriors are treated with a process called calcining, whitewashing with lime to seal the porous rock and brick used to build these churches. Inside the school where we live, we also have a form of calcining on our ceilings called limewash, which is a sort of chalky, almost dusty layer of calcium hydroxide. Here you can see some of it peeling off, and I wonder how much calcium particulate is present in the interior environment of the school. Our trip to Ribe produced something unexpected. The puffiness I've experienced since moving to Sjælland went away within hours of being in Ribe. I felt so much better too, looser and with less muscle pain. I was able to do a lot of walking around Ribe that would have been much more painful on Sjælland. I noticed my own lack of puffiness in our hotel in Ribe and took a photo to keep a documented record. My theory is that we were 3 hours away from all the calcium in the bedrock. There's still a chalk belt under Ribe, but as our neighbor here on Sjælland later told me, there are newer sedimentary deposits of sand on Jutland that aren't present on Sjælland, and these deposits cover the chalk. However, maybe more importantly, our hotel room had no limewash on the ceiling. This could be why I woke up feeling so good. If tons of calcium in the geology and the architecture is getting into my body and calcifying my fascia, less exposure to the calcium might be having this positive effect. But in addition to feeling better in Ribe, this town drew me to learn more about Petrus Severinus and his work documenting the medical philosophy of Paracelsus. Coincidentally, and of course there are no coincidences, I'm still doing research for the Tartar Woman series, and it'll be out in my next video in that series that the Austrian writer Arthur Schnitzler's one-act play called Paracelsus makes a specific mention of the alchemist's travels in Tartary. In fact, Paracelsus is said to have been captured by the Tartars, and that they greatly respected and admired his medical skills. If you're familiar with my work, you know Tartary is a place I've shown to be legally and economically non-corporate, non-binding, and non-enjoining. It could be that the Tartars recognized the value of the act of separation in his philosophy, and that it resonated with them in the same way that it resonates with me. In Paracelsian terms, gout is a Tartar disease, a failure of the body to properly separate an impurity. And I'm going to try the stinging nettle tea that Burnet, himself a Paracelsian, recommends for eliminating the gravel deposits of gout. I don't think I have gout, but this is exactly how I feel, that there is a mechanical irritation in my lower back. I don't really believe there's a significant difference between crystals of uric acid, calcium, or even tartar. In the big picture, it's simply a failure of the body to dissolve a crystallized impurity. All these puzzle pieces showing up in Ribe, they tell us to be vigilant and observant, looking for what the world wants to show us, even when we're just on a short overnight stay in the oldest city in Scandinavia.